Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today's topic is trigeminal neuralgia. This neurologic disorder affects the facial nerve and can be truly life-altering. Joining me today is Dr. Bryn Henderson, a leading expert in regenerative and integrative medicine. We'll talk about what causes this condition, how it's diagnosed, how it's treated, and the hope new therapies are bringing to patients worldwide. Doctor, welcome. Let's begin with the basics. What exactly is trigeminal neuralgia?
Well, thank you. And trigeminal neuralgia is a chronic pain condition that affects the trigeminal nerve. No surprise there. It provides sensation to the face, and it can cause sudden, severe, electric shock-like pain on one side of the face, often triggered by routine activities like brushing your teeth or even feeling a breeze. It's divided into classical, idiopathic, and secondary types. It depends upon the cause.
And let's explain to our listeners where the trigeminal nerve is located.
The trigeminal nerve is known as the fifth cranial nerve. It emerges from the brainstem at the level of the pons, that's in the brainstem. It branches into three main divisions, the ophthalmic, maxillary, and mandibular, each responsible for sensation in different parts of the face. These branches supply the forehead and eye area, the cheek and upper jaw, and the lower jaw, respectively. They play a critical role in facial sensation and motor control for chewing.
Can it run in families?
Yes. While most cases are sporadic, studies have shown familial clustering about 15% of the cases, and that there's growing evidence that genetic factors, particularly involving ion channel dysfunction, may predispose some people to develop trigeminal neuralgia, especially when neurovascular compression is present.
All right, so before birth, could early development have anything to do with it?
So far, there's no clear evidence that problems during the developmental stages before birth directly cause trigeminal neuralgia. But some experts think that small differences in how blood vessels form in the head later in life make it easier for them to press on the trigeminal nerve. This is still being studied.
Let's shift gears. What does traditional Chinese medicine do about trigeminal neuralgia?
Trigeminal neuralgia in traditional Chinese medicine is often attributed to factors like wind and cold or liver and kidney deficiencies. Treatments often include acupuncture, moxibustion, and herbal formulations. Studies have shown that acupuncture, especially electropuncture, can modulate pain pathways and reduce flare-ups, especially when combined with conventional therapy.
What are some of the typical symptoms that patients present with at your office?
I think the hallmark symptom is paradoxical. That means you don't know it's coming. Facial pain. It's sudden and it's brief, but excruciating. It's often described as a stabbing or electric, usually on one side of the face, not both. Pain is typically triggered by touch, talking, chewing, or even washing your face. Some patients also develop a dull ache or burning between attacks.
Do we know what causes it?
The most common cause of classical trigeminal neuralgia is compression of the trigeminal nerve by a nearby blood vessel, which damages the myelin sheath. That's like the sock that goes over the nerve. And secondary causes include multiple sclerosis or tumors. And of course, there's always idiopathic, means we don't know what it's due to.
You're not going to believe this, but during COVID, I was a COVID doctor for a year and a half, saw only COVID patients. I had patients that when people started losing their smell and their taste would get trigeminal neuralgia during COVID. Did you have anything like that?
We had so many variations of COVID in our office. It's very hard.
Stick out.
It had so many people coming in with so many diverse symptoms. Very challenging.
All right. So moving back to diagnosing trigeminal neuralgia, let's talk about the clinical ways that a doctor or physician would use to diagnose it.
Okay, that makes sense because the diagnosis is clinical. It's based on the patient's pain characteristics. An MRI is critical to rule out secondary causes, but most neurologists may also use neurophysiological testing. They're used to assess the function of the nervous system, including the brain, spinal cord, and nerves. These tests help diagnose and monitor various neurological conditions and injuries by measuring the electrical activity and nerve conduction. To evaluate the integrity of the trigeminal pathways is when the diagnosis becomes clear.
Okay, so what is standard of care today with treatment?
The first line treatment is pharmacological. There's various medications that are used that help control these symptoms. If medications fail or cause side effects, we looked for surgical options like microvascular decompression, radiofrequency ablation, or gamma knife radiosurgery.
So wait a minute, are you talking about killing the nerve or around the nerve?
Sometimes you have to modulate what the conduction capability of the nerve is. When you ablate something, that means you zap it so it does not transmit.
All right, well, let's get to something a little happier, like regenerative medicine. What are you using today for trigeminal neuralgia?
Yeah, this is exciting. There's no question. We have platelet-rich plasma, that's PRP, which has been shown encouraging results in small studies by promoting healing, nerve regeneration when injected near affected branches.
But a doctor would have to be like you that knows every nerve in the body. You wouldn't trust just a regular family practice physician.
Well, you'd have to be cognizant of what nerves go where.
Right.
And the other thing that's major is what's the circulation feeding those nerves.
Yeah. Well, what about lifestyle? We've talked about that with some of our other pathologies. How can lifestyle help patients with trigeminal neuralgia?
Lifestyle plays a big role in managing trigeminal neuralgia. I recommend anti-inflammatories, diets rich in omega-3s and antioxidants and magnesium help. Stress reduction helps probably for your entire body, but very strong assistance for neuralgias. It could be mindfulness or biofeedback, like discussed. Avoiding known triggers is a big deal. Cold weather, breezes, loud chewing, any facial stimulation. And of course, get a good night's sleep, get good hygiene and emotional support for stressors.
How often do patients with trigeminal neuralgia have to see a doctor? I mean, if they know they have it, why do they have to go back to the doctor? If they know their triggers come, then they know, do they have to go to the doctor?
Usually we see more often during flare-ups. When you start getting flares, they often need injections. We monitor their pain, we tailor their medications to the side effects, and we help them with their mental health. This is a very stressful and very difficult time because little things, think of it, a breeze can trigger this pain.
Well, and also their face.
Oh, no question.
Their face, because it falls on one side and they're embarrassed to go out in public.
Yeah, we get droopy.
Yeah. So let's hear your mnemonic for trigeminal neuralgia. What's it called?
Well, it's no surprise, it's trigeminal.
Okay, T stands for?
Talk to your physician and get an early diagnosis and treatment plan, which are key to controlling facial pain.
R.
Recognize trigger zones. Common areas include cheeks, jaw, and around the eye. Even light touch can trigger sharp pain.
I.
Identify and avoid triggers. Wind, brushing your teeth, chewing, and of course, stress can provoke episodes. Modify those routines when needed.
G.
Gabapentin help with nerve modulation.
E.
Explore other medication options. baclofen or other muscle relaxants.
M.
Minimize stress. Relaxation techniques and good sleep reduce attack frequency.
I.
Investigate surgical options when necessary. For medication-resistant cases, for example, consider procedures that are micro decompressions or radiosurgery.
N.
Nutritional support. B12 and magnesium may support nerve health, and ask your doctor before supplementing.
A.
Apply warmth and code very carefully, as there could be triggers. Some patients find gentle heat or cold packs helpful. Test what suits you.
L.
Live with support. Join support groups. Talk with a counselor. Trigeminal neuralgia can affect the mental health and well-being not only of you, but your entire family.
Well, Dr. Henderson, thank you so much for enlightening us on trigeminal neuralgia. It may be rare, but its impact is profound. Thank you for telling us about the medication, the surgery, regenerative therapies, and talking it out with a psychologist or somebody to help you not get depressed and get hopeless. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.